something happening here. What it is ain't exactly clear.
Yeah, something sure is happening here, and what it is ain't exactly clear. And Retake Our Democracy in this radio show, in our blog, and in our Zoominars and our statewide network alert system, we try and keep you informed, and we try and keep you active. And so welcome and good morning. Today is July 4th. And you're listening to Retake Our Democracy, a 30-minute radio show that airs every Saturday morning at 8:30 a.m. on KSFR 101.1 FM, your public radio station. And I'm Paul Gibson, the host of Retake Our Democracy. And last week, we spoke with Laura Ives and Jeff Haas. Laura is the former legal director for the ACLU of New Mexico, and also a former public defender. And currently she is a partner at Civil Rights Law, an Albuquerque law firm that is representing Scott Williams, who was shot in the back by Stephen Baca, a vigilante, at a June 10th rally in Albuquerque, a peaceful rally, I might add. And Jeff Haas was also on the radio show, and he's a friend, husband of Mary Feldblum, and a Santa Fe attorney who represented the family of Fred Hampton, the Black Panther who was murdered in Chicago in 1969 by the Chicago police. He has also represented a litany of other clients over his 50-year career as a civil rights and environmental justice lawyer, including many of those who were arrested at Standing Rock. We spoke about the June 10th shooting at the peaceful protest. And we used that as kind of the police lack of response, really the Albuquerque police lack of response in that incident, as a launching point for discussing the Albuquerque Police Department climate, their operating, the way they operate, and the way that the police union kind of obstructs the any kind of oversight and transparency or accountability in relation to any bad cops that they may have. We then ranged into a broader conversation about police culture and system and criminal justice system nationwide. It was really, really, really a good show, and I want to recommend you catch it if you can. And you can get all of our old shows by just going to Retake Our Democracy's homepage. That's retakeourdemocracy.org, hovering over the actions and events in the menu bar there, and you'll see Retake Conversations. And Retake Conversations, we have all the old shows, and this show will be up and recorded by about 10 o'clock on Saturday morning. And it will include an extended conversation with our guest for today, who is Mary Feldblum, the executive director for Health Security for New Mexicans campaign. And she's been pushing for a Health Security Act for almost 20 years. And we're kind of hoping this is the year in 2021 that she gets it done. And so that's going to be an excellent show. We're going to get to that in just a second. But before we get started, I want to remind our listeners that Retake will be moderating yet 2 more Zoominars coming up. And those Zoominars include one with Mary Feldblum and the director of the Health Security for New Mexico campaign, who you'll be hearing from in just a minute. And she'll be joined by Shelley Manlev, who is the co-chair of the New Mexico Public Health Association, and Dr. Tyler Taylor. Dr. Tyler Taylor has been associated with the movement for quite some time. So if you'd like to hear that Zoominar, sign up for that Zoominar as soon as you can. Again, go to retakeourdemocracy.org and hover over the Actions and Events menu again. And there you'll see Zoominar series, and right in there you'll get the link to sign up for the Zoominar. And these Zoominars are getting increasingly full and selling out, so you'll want to do that as soon as possible. On July 21st, we will be hosting a panel with Kathleen Burke and Dick Mason, from fair districts for New Mexico. And Dick Mason is a lobbyist and board member for the League of Women Voters of New Mexico. And joining them will be New Mexico Senator Jerry Ortiz-Pino, one of my favorite legislators, who hails from Albuquerque, and Senator Mark Moores, who's a Republican. And we'll be discussing what the process will be for doing redistricting when it begins, what's at stake, and how we can all chime in. So you'll find both of those events, again, under the Zoominar series, hovering over the actions and events menu. One more quick note. Today is July 4th, and it is a very different July 4th than we've experienced before for a lot of reasons. And there is a national call for solidarity with Black Lives Matter, asking everyone to wear all black today. It's a small gesture, but small gestures and honesty are called for today. We have a very long haul ahead of us if we're going to fix this criminal justice system. And it's perfectly clear that just not being a racist is not enough, that we have to start to examine what it actually means to be an anti-racist, actively engaged in anti-racist activities. And part of that is just reflecting within at any racial prejudices we have ourselves. And so look for more on that from blogs from Retake Our Democracy. All right, let's get started. And we're gonna talk to Mary Feldblum. Welcome, Mary. Glad to have you with us today. I always like to ask our guests to introduce themselves. Can you just tell us a little bit about yourself and how you got involved in healthcare advocacy generally and the Health Security Act more specifically?
Sure. I'm an academic, former academic. My PhD is in sociology and economics. And when I came out to New Mexico, I left academia. This is 1986. And I decided to get involved in public policy. And the first area that I entered into was the environmental arena. And in the early 90s, Consumers Union, the publisher of Consumer Reports, hired me to direct their New Mexico healthcare project. And one of the issues they were concerned about was state-based universal coverage. And so that's how I got involved in this. And I worked with, there was the Progressive Alliance for Community Empowerment, a coalition, to see if there was something that we could do in New Mexico. And I had a strong relationship with Representative Max Call, who from Santa Fe, who was the chair of House Appropriations. He was a strong environmentalist, so I knew him. And he was fascinated with the idea of New Mexico setting up its own health plan. And at the time, he kept saying, you know, our budget is being eaten up by healthcare and the need for education. And either we're going to have unhealthy kids or stupid kids. And the choice is just not tenable.
Wow.
So, and that's the origin. That's the origin of New Mexicare, which was introduced in 1993. And since that time, we have been going around for 10 years. I've worked with Consumers Union on some other projects here in New Mexico, but primarily with that. And we went around the state, particularly in the southern part of the state, because they feel so much like they're adopted children.
Absolutely.
And we wanted to ask them the question, if we were to set up our own health plan, what worries you? What would it look like? And at the time in the 90s, of course, there was interest in universal health care. Clinton was elected president, and he tried to get through a plan. Managed care, all of a sudden, was the catch-all word.
Right.
And we just didn't feel like HMOs were going to solve the problems, and we kept plugging away. And we had workshops, meetings, and when the bill kept getting introduced every 2 years, because as your listeners probably know, we have a 60-day session where substantive bills can get introduced, and the 30-day is the budget only, pretty much, unless the governor wants a substantive bill. And so when we introduced it, it would always change. It was always getting better and better and better. And so right now, what we have is smothered in green and red chili. There's nothing like it in the country. I think it's the best. It's the best bill in the nation, quite honestly, because of the input we've received from so many New Mexicans.
So you sort of answered my second question, which was, tell us a little bit about how it has evolved over time. So why don't we just dig in? And most of our listeners, I think, have some familiarity with the Health Security Act, but I think a lot of people also could have some misconceptions. So how about if you tell us a little bit about what it is and what it isn't?
I think it's really important, and we encourage listeners to go to our website and sign up for our workshops, because one of the things we have learned over the years is that it is very important for people to know what's in this bill. It's not just a feel-good piece of legislation,
Right.
which it is. And what it would do is enable New Mexico to set up its own health plan that covers almost all New Mexicans. Not all New Mexicans will be included, but if they're excluded, they still have health coverage. So it's a universal healthcare system. It's a question of who's included in the plan. So there are two groups that are excluded. The military retirees and their families. It would be a very difficult situation to address their healthcare needs, but they have a healthcare system, so they're covered. Then federal retirees are excluded, because as a federal retiree, it would make a lot of sense for them to join a plan with younger people. But if they move out of state, they never can go back into their federal system. And you can't do that to people. So
Right.
we have excluded them. So those are the two groups. It's a relatively small number of people, actually. And then there are two groups that can voluntarily join. We've had a lot of conversations over the years with the tribes. They're sovereign nations. They're definitely worried about IHS dollars being diminished. And
What's IHS dollars? Indian Health Service, correct?
Indian Health Service, yeah. And as we all know, the Navajo have been enormously impacted by the coronavirus. And so what they can, as sovereign nations, they can voluntarily join. They can decide how they want to fit in, and that there is not going to be any deals cut with IHS without their inclusion.
Okay.
And then there's another group, and this is an important group. These are companies, and then there are unions that have their own plans, their own they collect the premiums and invest them. And Intel is a good example, PNM. And they come under a federal law called ERISA. It's the Employee Retirement Income Security Act. And ERISA, companies that self-insure cannot be regulated by state superintendents of insurance. So their employees have no protections, state protections. And it's many superintendent of insurance around the country, or commissioners of insurance, really dislike ERISA because there are no protections where employees and companies can do what they will. They can offer what they want. There's no regulation. And so states can't mandate anything. If you're self-insured, you're basically your own entity. And but what they can do is ask them to voluntarily join. And they will, because study after study is indicating they are paying a lot of money for healthcare. It's very costly for them. And if they join the health security plan, they understand that the economies of scale. If you have 3,000 employees and you're joining a plan that has 1.8 million people in it, obviously economies of scale is very important. Plus the fact that the Health Security Act requires that workers' compensation and auto insurance premiums be reduced because they have large health components. And so if this plan pays for that injury or that auto accident, then you don't need to, you shouldn't have to pay double in your premiums. And so that is a requirement. And New Mexico has probably one of the highest workers' compensation premiums in the nation. And so that's going to be very appealing, I think, to companies when they join the Health Security Act. So almost all New Mexicans really would be included. And everybody in the plan has complete freedom of choice of doctor and hospital, including across state lines. And the services offered, and this is what we've always assumed, would be no less than what the state employees have. It's the same package of services that educational employees have. And I'm not talking about copays, deductibles, premiums. I'm talking about the actual old-fashioned services that the plans offer. Good mental health, behavioral health, acupuncture, chiropractic treatments. It's a wonderful preventive care provisions. And so it is an excellent package that then all New Mexicans would have. It would be administered by a citizens board. It's not a state agency that would be administering this. Over the years, that nobody wanted that. So it's like a co-op. That's what some farmers and ranchers said to me in the northeastern part of the state. Oh, this sounds like a co-op. And so of the board, there are 10 who represent consumer and business interests, and 5 representing health facility provider interests. So no elected official, no cabinet secretary, nobody from the insurance industry can sit on this commission. And the commissioners themselves must be recipients of the plan. So if I'm military and excluded from the plan, then I'm not able to sit on that commission.
Right.
So
right.
in that sense, its meetings are open to the public. Its books will be subject to, accounting books will be subject to public scrutiny. It can't make decisions behind closed doors. The Rules Act, the State Rules Act would apply. So it is an open entity that, and what is really important too is that these commissioners have to be geographically representative. And actually only 4 would come from Albuquerque and 2 from Santa Fe. So of the 15, 9 come from outside of Albuquerque and Santa Fe. And
Okay.
applause for that, because and these are the original sponsors, Representative Max Call and Lucky Varela from Santa Fe, that felt that outside Albuquerque and Santa Fe people had to feel that this was going to be their plan. This was not going to just benefit Albuquerque and Santa Fe. So that's part of it. It's and then it's paid for by using existing federal dollars and state dollars that are already paying for services like this.
Right.
For example, Medicaid does not, this plan does not include long-term care. So Medicaid does have long-term care. So that stays within the Human Services Department. But there are federal dollars, state dollars that can use to offset the cost. And then the remainder is made up with premiums based on your income. So if your income goes down, your premium goes down. And there's a dollar cap to it, supposed to be $1 cap, and a minimum below which people wouldn't pay. For instance, in Medicaid, people do not pay premiums. And there probably could be other low-income people not eligible for Medicaid that might pay $1 a day or something. You know, that it's a sliding scale, dependent on your income. And then employers would make what we call a contribution based on payroll and number of employees. So that is a much more sensitive formula to small employers. And there would be a cap, again, a cap and a minimum below which maybe some employers wouldn't have to contribute because they're so marginal. And but it's so that's the way it would be paid for. The bill has been structured. So, I mean, people need to understand that when it passes this coming session, it's not going to be in effect for 2 or 3 years. So there's a lot of work for this commission to do to make sure this plan is up and running and well. And there's going to be a lot of public input into the details. Doctors will have a say, hospitals, we as consumers will have a say. You know, we have to assume that the plan isn't going to be perfect, So what are our rights, right? You know, what do I, if I have a complaint as a consumer, you know, what's the process? All this has to be worked out. And then, of course, there has always been a provision to allow, to figure out the numbers. You know, is this plan affordable? We've had 2 studies done in New Mexico.
I'm going to have to put you on pause here for a second, Mary. I got to remind our listeners that I'm talking with Mary Feldblum, the Executive Director for Health Security for New Mexicans campaign. And I want you to hold off on that thought, because we're going to get to that. And so you're a little bit like my friend Marielle. You ask her one question and the whole interview unfolds.
It's finished.
And so I have to jump in every once in a while to remind people where we're at in this. And so what I wanted you to get to is, you know, there are, you've given already enough of a picture of what this legislation would do, but obviously there are people who have expressed concerns. Can you, you know, otherwise it'd be law 18 years ago and you'd be advocating for something else. So what are some of those concerns? And why are you optimistic that this go round you're going to get it done?
Well, I think, you know, I remember early on in so many of the hearings, the insurance industry would say, on page this, or this is a problem, that's a problem. We would write things down and we corrected a whole lot of stuff. So in the past few years, they don't tear apart the details. It's a question of points like, well, the Affordable Care Act is working, you know, let's let that happen.
Yeah, it's working real well.
But I think, I mean, it's not surprising that the insurance industry would be very much opposed to this. There are some, I think, the Hospital Association has not been friendly to this, even though rural hospitals really have been very supportive, you know, when I've had conversations with them. And then I think legislators, you know, this is big. This is a big step to take. And we have had to educate people in various legislative districts to have them tell their legislators that they think that this is worth doing. And we built in a structure so that it's not immediate. It's gonna be, you know, it's gonna take 2 or 3 years to set up, and which I think makes a lot of people feel much more comfortable. I think that the political, economic, healthcare situation, particularly with coronavirus, has created so many concerns about our healthcare system. People, you know, were very comfortable with the idea of employment, providing health insurance, and I think that's raised big flags for people. So you don't, you know, no more. Can you count on that? I think the pharmaceutical drug industry has created so many problems prior to the pandemic, and now we're hearing about huge costs. Gilead, for its miracle drug that will make you stay in the hospital maybe 4 days less, is talking about $3,000. You know, I mean, it's an enormous cost for a drug that some say should really cost $200.
Well, and the U.S. paid for all the research and development. So,
right.
Like,
Yeah, they paid $70 million.
Where do I get that job, you know?
So, you know, and our hospitals are in trouble. And there are provisions. It's not only that Health Security is so, you know, allowing everybody to have guaranteed coverage, but there are mechanisms to control costs. And the Affordable Care Act failed in that. You know, a lot of people got coverage through it, which is wonderful, but it clearly hasn't solved the cost problem. And one way to do that is to do something that maybe your listeners have never heard of. Is called global budgets. I know you know about that.
Yeah.
Because we tried to get a memorial passed last session that would explore this. And what this essentially means is hospitals would no longer have pages and pages of charges. They would get a guaranteed revenue stream that would be paid to them monthly or quarterly based on their budget. And of course, rural hospitals have been cutting like crazy. So you want to make sure that their budget is an adequate budget, that it can actually provide services they need to provide. And Maryland and Pennsylvania are actually exploring this. There's federal dollars available to do this. New Mexico should start the process right away of doing global budgets. Also, pharmaceutical drugs. I mean, Senator Steinborn very worried about the cost of drugs, and there's a pharmaceutical purchasing council that was set up. He had a bill, and it was set up, and they're meeting to figure out ways to maybe engage in bulk purchasing of drugs. And there was a bill passed last session that allows the state to get to apply to the federal government so that certain drugs could be imported from Canada.
Right.
But bulk purchasing of drugs is again a mechanism to save money, but also in the Health Security Act, there's other medical equipment and supplies that could also be purchased, like oxygen tanks or wheelchairs.
Mm-hmm.
Not everybody needs them, but if you do bulk purchasing, you're going to get just better prices. So, and all the European countries, that's one of, they all have these negotiated prices, and the United States relies simply on the free market to determine.
Well, and that's been the problem with the whole COVID response. It's like you figure it out, states, so they're all bidding against each other for PPEs and for test kits and so forth. And they're in short supply where they're desperately needed, and there's an abundance where they're not needed. It's just crazy. So I think all of this is sort of providing more evidence for the need for something like the Health Security Act. But also had 2 studies done, and we've only got about 2 minutes. But if you could start talking about the 2 studies that have been done prior to the most recent one, then we'll dig into the others as part of the podcast. So could tell us about the Mathematica, and what was the other firm that
Lewin. The Lewin one was done in '94, and the Mathematica was done in 2007.
Right.
And it's both of them. The Mathematica one is more similar to the Health Security Act. The Lewin one is much more of a straight single payer. They just assumed everybody was in. But both showed that if New Mexico insured all or most of its residents in one old-fashioned health risk pool, that hundreds of millions, if not billions of dollars would be saved within 5 years. And they both came up with how you pay for it ideas, and both of them said it was very affordable. And I think what's important to think about, because well, these are old. Yeah, they are old, but they happened prior to the Affordable Care Act.
Correct.
And the Affordable Care Act assumed Medicaid expansion. It assumed subsidies and tax credits. So there was additional revenue from the federal government due to the Affordable Care Act that was not assumed in these 2 studies, and it was still affordable. The other important point is that New Mexico and Texas were fighting for the honor of having the largest percentage of uninsured. It was anywhere between 21 to 22, 23% of our population was uninsured. And that adds a cost to a system of universal coverage, because you have to assume that they are getting services. And so if you're setting up a plan where they could get services, you have to factor that cost in. And
so we're going to have to stop here.
Okay.
The show's going to be over, but I want to leave you time to tell people where they can get more information and how they can support the HSA.
Okay. We have a website. It's www.nmhealthsecurity.org, and your listeners could donate, because we need donations to keep doing the work we're doing. But it gives you a lot of information.
Sure
and
does.
You can sign up on our to receive our email information alerts, and to know about when workshops will be held. I think it's really important to take a workshop and to read for yourselves what's in this bill.
I can attest to that. Roxanne and I did one. It was a half-day session on the financing behind it, and it was so instructive. And of course, our listeners could also sign up for the Zoominar that we'll have with Mary on Tuesday evening, and you can get information about that at retakeourdemocracy.org. Hover over the Actions and Events menu, and you'll find Zoominar series, and click there and register. And that's all the time we have for today. We'll be back next week with another exciting show. And for those of you who are listening on podcast, we're just going to be silent for a second so that we can have a transition from the radio show to the podcast. So we'll be right back. And by the miracle of podcast, here we are. And we're with Mary Feldblum, and she was talking about the two studies that have been conducted, one by Mathematica and one by Lewin, that outlined hundreds of millions of dollars in savings for the state if we forged on with plans very similar to the HSA we have now. And she had also indicated that, you know, the health finance environment in which those two studies were conducted and showed huge savings were conducted in an environment without the ACA and without our New Mexico having done a lot of Medicaid expansion. And both of those things bring resources, federal resources to the table that weren't captured in those plans. So with that kind of a transition and summary, it would just sounds like everything was just lining up perfectly for you. And then you get the results from the preliminary report from KNG Health Consulting. And I'm just guessing you weren't real happy. And in fact, I know that because I've read your 30-page response. So can you tell our listeners just a little bit about that independent study, what it found, and what you found wanting?
Well, let me stress it was preliminary.
Yes.
And we're asking serious questions whether this company is capable of, in fact, making the corrections that they need to do. The request for proposal did something that I thought was very smart, and it's my own background in sociology and economics, and in looking at over the years, I've really looked at so many of these studies, and there's so many unknowns that we don't know who's going to be president.
Right.
We don't know even.
We hope we know.
But even if we get a new president, we don't quite know how things are going to play out. And you know, there's the Senate, which is it's not just the president. So there are those unknowns, and then there's the unknowns of the economy. We all of a sudden with the coronavirus, the number of uninsured has gone up enormously.
Right.
And that it's so what the request for proposal said, they wanted not just one magic cost number, but different scenarios to look at. And economists love this, what ifs, So here's scenario A, making these assumptions, scenario B, and KNG didn't do that. That's a real problem. And the other thing is that the RFP requested was that they use New Mexico data. The Mathematica study has table after table of information on New Mexico, and they're basing information on New Mexico's experience. We see no tables, nothing. There's no information. There's a reference that we looked at hospital data, but what data did they look at? So they are completely lacking, not only in New Mexico data, but in justifying their assumptions and points. They don't, all of a sudden, for instance, they're supposed to start, assume that the Health Security Act is supposed to start in 2024. And it's supposed to be a 5-year projection, because obviously that's important, because when you start up a new program like this, you have to assume that its administrative costs are going to be higher in the beginning, and it takes some time for it to settle. And so a 5-year projection, it makes a lot of sense, and that was in the RFP. So they all of a sudden start off with, here's what New Mexico is spending on healthcare in 2024. That they didn't tell us how they get there. You start off with what New Mexico is spending in 2019, which would be the latest data.
Right, that'd be a good start.
Yeah, and then you have to say, okay, now we make these adjustments, and this is how we're arriving at baseline in 2024. No, they just announce it. They got a table. There it is, and so then they do that all the time. Is all of a sudden say, okay, this is what we're doing, and they don't tell you they don't justify it. They've got what's called a micro simulation model, which I know can be very intimidating to people, even to my own staff. And it's there. In my comments, I explain a difference between a micro and a macro approach. But in a modeling system, what you put in is critical, and every one of us has a right to know what they're putting in, what's the data they're putting in, what's the assumptions that they're putting in, and they don't tell us. They really don't. It's very.
Well, in fact, if I read I read your whole report, did a blog on it today. We're recording this on Thursday. And one of the things you had was at every point when they were figuring out costs, they minimized any kind of possible reduction, lower costs because of the effectiveness or efficiency of the system itself. And so it's almost as if these compounding factors lead them to a conclusion, but these compounding factors are built on a castle of sand. Can you talk a little bit about that?
Yeah, what I find honestly so fascinating is that there are 2 tables that are very interesting to look at. And in one table, they spell out from 2024 to 2028 the annual costs of the current system. And then in a second table, they spell out the costs of health security. We don't know how they arrived at these numbers, but if you just take those numbers and you put them in a chart, which I did, and said, okay, this is what Mathematica did, what Lewin did. You take a look at the curve of the current system, what that looks like in terms of cost. Mm-hmm. And then you look at the cost of the health security plan based on their numbers, and the savings are enormous. I mean, it
was $3 billion a year, right?
Over a 5-year period, $16.1 billion. And by savings, I mean I'm not talking about health costs going down. It's a comparison of the rate of increase of costs of health security and the current system. So that is a real shocking piece of information that comes out of their data. So then you have to ask, well, because then what they emphasize in their report is that there's a shortfall. So there's one thing to figure out the cost of the health security plan. And then the other part is the revenue side. How do you pay for it? And so all of a sudden they miraculously come up with a $7 billion shortfall. And the first question is, how can a system that's so much cheaper than the current system, how can that end up with a shortfall? It makes no sense. That's number one. Number two is looking at, what are they looking at to create this shortfall? Well, one thing that they did was make an assumption about public dollars. Remember when I mentioned that once you figure the cost of the plan, you have to figure out what public dollars are available to offset the costs, like Medicaid, right? So they have come up with a number of what they consider to be public dollars to offset the cost. And they don't tell us what programs they're looking at. They don't tell us, it's just, here it is, here's this number. And Dr. Tyler Taylor, who's on our board, worked very carefully with some people in the department, people they've now retired, Human Services Department, who know about these programs. And he calculated that they were $6 billion off the mark. They have not, that there is $6 billion available that they didn't count on to offset the costs, which is a major, major error. And unlike them, he spells it out, which programs and what money can be.
Right. Well,
and
even if you took then somehow their magical $7 billion shortfall, who will be on the Zoominar, by the way, has found 6.1 billion that would erase almost all of that. And your other chart, which is in the blog today, shows that, well, it may be affordable after all, since it's $16 billion cheaper than doing nothing, right? Isn't that essentially your argument?
Yeah. Oh, well, and it has to be. The other piece of it is how they're setting up the premium and employer contribution side, and gets a little, in terms of the employers, they are assuming that remember I talked about the self-insured companies like Intel, right. They're assuming that they won't join, which is wrong. I mean, Mathematica assumed that they all would. I don't know where they get that information and why. So that's a loss of revenue right away, because but what is fascinating to me is they add a cost to the plan, because they say, well, the Health Security Act does not prohibit individual employees from Intel from joining the plan. So they have made a calculation, so that's adding individuals, and they've sort of figured about 50% of the self-insured. Again, I don't know where they get these numbers and calculations from, but they're saying 50% of the employees of self-insured companies would join the plan. But there's no revenue side from the employer. In other words, one of the biggest ones I think everybody knows about is Walmart's. Walmart's is self-insured for its management. And they count on low-income people who could get Medicaid. And it's basically taxpayer dollars, and Medicare, the seniors who welcome you. But essentially what Kanji was saying was, well, these individuals can join the plan, but Walmart won't have to pay. And I'm glad they flagged this, because we're going to correct that to make sure it's very clear that employees of any company, that company has to contribute. So that's a lost revenue source. So and there are others, and the way they design their payroll and premiums is basically, they didn't put caps on them. They didn't do a payroll number of employees, sensitivity. They don't give us a chart so we could see how many companies, with these employees would pay X or Y. And they base it all on the current private market. They say, 8% is what employers who provide insurance, they're not including the self-insured, pay for in payroll for healthcare. They never give us the data. And so we're going to assume 8%. It's just like, excuse me?
It's higher than that, though, isn't it?
The current system that assumes all the inefficiencies of the current system.
True.
It's the backward way of figuring out how this plan costs. So it is the revenue side is so off the wall, and of course their cost side, we don't have any idea
how they arrived.
How they arrived at it.
So I'm guessing you weren't looking to have this report be something you had to explain away or fix. But is there a way you can turn this to your advantage with the legislators?
Well, they're having talked to some of the legislators, and of course, what's wonderful is both Senator Ortiz-Pino and Representative Armstrong are horrified at this study, and they're considered the experts. And The question then becomes, if we don't have this study, can we proceed? And of course we can. You've got evidence from not only New Mexico studies, but you also have other studies that were done more recently in New York and California that also show substantial savings. So then, and we really need something new and different. And I've heard candidates who are running for office, some of them are new candidates, saying that people are desperate for new ideas. And you explain, let's set up our own health plan in New Mexico, and let's do it slowly and carefully. So that this coming session, we all know, I mean, there are a couple of surprises, aside from the KNG incompetence. We lost two very important people in the legislature. Senator Carlos Cisneros, who was the vice chair of Senate Finance, was a sponsor for many years, very powerful, and he passed away, as did Representative Bill Pratt in the House, a physician. And to lose two major sponsors like that was, but others are stepping up to the plate, which is important. And then, of course, we have the budget crisis. We have the problem of, oil and gas revenues going down, and it's obviously there's a big shortfall that the legislature is going to have to think about. So when health security is introduced, if it were done in a year where oil and gas monies were plentiful, we could use some money for the setup costs, right? Because you're going to have to set up this commission, and this commission is going to have staff and an attorney. It's going to have to do a lot of work before the plan is up and running. So what we're looking at is ways to finance the setup. That does not mean going into the general fund.
God, we don't have a public bank.
Yeah,
this is the perfect project for a public bank.
But there was a bill passed this past session for small businesses, and loans come out of the severance tax fund. We have funds in New Mexico. We have a New Mexico Finance Authority. So there's going to be ways, I think, that money can be loaned and to set this up and not have to take from education and Medicaid and in the general fund.
I think somewhat the political, I know that advocates like you don't like to badmouth anybody who is a legislator and has a role in the roundhouse, because you never know when you're going to need them. But I also know that you're well aware that the June primary made some significant changes in the state Senate, where some of those incumbents who were defeated by challengers will be replaced by people who are going to be much more predisposed to support the Health Security Act. So that's going to be something you're happy about.
Well, definitely. There may be one or two of those candidates that will have a tight race. We don't know the outcome, but there's no question that there's going to be a change in the Senate, given what happened in the primaries, and that does benefit us. We are nonpartisan health security campaign, and I know it can be very surprising for people, but we've had 37 cities and counties endorse the Health Security Act. It's been about bipartisan at the local level. Valencia County, a year and a half ago, that's 4 Republicans and 1 Democrat on that county commission, unanimously endorsed this. My county commission, Sandoval, also has endorsed this. And Roswell City Council a while ago, I mean, that one really surprises people, also endorsed this. So we, at the local level, and I think what's interesting is I think more Republicans in the Senate and the House are expressing an interest. I don't know whether that means that, and I hope that they will support it. There was a memorial passed in 2019 to do a cost analysis of the Health Security Act, and in the House, and 3 Republicans joined that. All the Democrats have voted for it. So I am always hopeful, because there's a lot of local Republicans that say, they have bodies, they want freedom of choice of doctor, they're worried about insurance companies and pharmaceutical drugs, and I think we have come up with something that is going to be carefully developed, and is not a state agency, and is respectful of rural New Mexico. I think that they hopefully some of them will support this.
And I hope that in 2020, when it's introduced, we're able to be there together and raise our voices in support of it instead of doing it by Zoom. I'm not terribly optimistic that's going to be the case, but it would be nice to see you in that context. I have 2 more questions, and I ask every guest these questions. The first is that Retake sort of assumes that the systems, the political, the health, the economic systems that have delivered us gross wealth inequality and gross health insecurity and all the other problems we're beset with are not the systems that need to fix this. They're not going to. They're too entrenched. And so we feel like there's got to be this visioning process to come up with a new set of systems and a new normal, if you will. What would that look like to you? And you don't have to limit it to health coverage, but you can.
Well, I think for so many years now, and the Koch brothers were certainly behind this, is bashing government.
Right.
Bashing and saying that the market will solve problems. And I think that all of a sudden, with the pandemic, where people are saying there is a role for government, and I think the whole issue about transparency and accountability is really important. But I do think that we have an opportunity to develop a positive image of government that it should serve and help people, and whether it's in the environment, for environmental rules and regulations, or healthcare. And I think that's incredible. The other piece of it is I think the issue of the market solves everything. I'm going back to Adam Smith and having a conversation with him. But it's that has been something that has taken over even Democrats,
Right.
in terms of their attitude. And I think that it has been a serious problem, because, and when you think about it, not only with pharmaceutical drugs being able to charge whatever they want, and Congress still hasn't come up with a cost control mechanism, but you also have the problem of hospitals being bought out by these conglomerates. You have bigness, there's this whole, capitalism and competition. You're supposed to have a lot of different competing entities, and we're finding concentration of capital. And we're also finding that Wall Street is not regulated well enough. And so I think that there's a new normal. There's a challenge if the Democrats win to try and come up with a system that is just and fair, and they rely on competition where it's useful, but also understands the role of regulation. And I think that was a nasty word for a long time. And just let the oil and gas companies do what they need to do. Why regulation interferes with their business model. And I'm hoping that we've learned a lot, and that a lot of that will change. I was heartened to discover that in Carlsbad, there's a whole group of people there that feel that OCD, the Oil Conservation Division, isn't regulating enough, isn't protecting them enough. And so, they want to make sure that they're protected. And I think it's very healthy. But I also feel that we tend to be a very passive people. I mean, these new demonstrations now with Black Lives Matter and have multi-ethnic, white, young, old people participate is really fantastic to see that. But it's, but I also think it's so important for people to understand how you change the political process. What is it's not just the elections, but what do you do afterwards?
Right. We're going to have our work cut out for us. Even if we get rid of him, it's not over.
Yeah, it's
Even
not.
If we take the Senate, because we've seen having control of the Senate here, 26-16, and it didn't work so well because, some people need to be pushed pretty hard and some need to be pushed out the door. And they've been doing a good job of that. In New York, they just did a very good job again. They've elected a slew of new, young people of color to the House of Representatives. And so but we'll have more work to do.
It's
question for you. Go ahead.
Well, it's kind of, I think, when you think about it, our kids are not taught how to have impact on the system. And I as a PhD teaching social problems, when I came out to New Mexico in 1986, I was asked if I could lobby for, it was called the Right to Know Task Force. It was to require employers in our state to inform and train employees about the hazardous chemicals they're exposed to. And it was right up my alley. And I said, but I know nothing about lobbying. What do I do? Here I am, a social scientist, analyzing social problems, looking at policies, and I didn't know how, diddly squat about how to implement them.
Yeah.
And so, and I've learned and I got involved with teaching people about lobbying and that you do have power, and particularly in our state, it's really incredible the amount of power that people can have in small communities.
Well, if you even take a step back from that, you were saying we aren't taught in school to how to advocate or what the civic process is really like, but increasingly you're not taught to think either.
Right.
To remember facts, and the facts that they fill you with are meaningless. But you're not taught to be critical. And so if you're brought up in a house that watches Fox News, the light may not ever go on that what you're hearing is nonsense.
Yeah.
And so you're not able to weigh competing points of view. And I don't think that's an accident. I mean, I think that the education system has been set up to create drones who will go to work every day, no matter what, and don't think too much about it. So in that context, last question, are you, despite it all, COVID, everything else, are you optimistic as you look forward?
I am. I'm optimistic, but there's a lot of hard work.
Right.
I take anything for granted. I just never do that. And whether it's the national elections, whether it's our state elections, whether it's the introduction of health security in 2021, we can't take it for granted. And our campaign is really working hard we want to educate people. That's why I hope your listeners will go to our website at www.nmhealthsecurity.org, join us, take our workshops, help us in their areas to educate more people and to make something that nobody could say no to, no legislator could say no to. They need to hear from constituents.
Yeah, and the time to call them also is not in January when, some aide or secretary is just making a note of one's for it, one's against it, but now and in the fall when you can have a conversation and just let them know this is coming and I'm paying attention and this needs to pass and let's talk about why, you know, and Retake will work with you to make sure we have some documents that we send out to our constituents that are with speaking points so that they can call their legislators now and start having those conversations, because we've got to we got to get this done. We got to get this done.
And they're all up for election.
Right.
So election years, they're all sensitive. Even if they don't have an opponent, they are all get very sensitive. So it's a wonderful time to meet with them, educate them, and really, you know, it's time to do this. It's not going to set it up right away. There's lots of phasing that will happen, but let's start this process of taking control of our healthcare.
Okay, well, thank you very much, Mary, for being with us today. This cool podcast, obviously, if someone's listening to this at all, they know that the podcast was up and running on Saturday, because otherwise they wouldn't see this. But we'll also have the Zoominar on Tuesday night at 6:30. And so I'd really encourage our listeners to head over to retakeourdemocracy.org, click on the actions and events menu, and you obviously know how to do it because you found this Retake Conversation. And just in that same menu, you'll see Zoominar's series, and also one page devoted to this series. And you click on either one and you can get a link. You can pre-register and you'll be in the Zoom room. So thank you very much, Mary. We'll see you again.
Thank you. Really appreciate Retake.
Stay healthy and hopeful and safe.
You too. You take it.
Bye-bye.